Hi there. I know you have heard that sugar is the cause of diabetes, right? Yes, I heard so too, right? And in this episode, we'll be looking at diabetes as a condition, and we're going to review the entire condition that you know as diabetes. And we'll try to simplify it with illustrations that you have never heard anywhere before. Okay, now before we dive into that, I would like us to look at this condition, the history of diabetes. All right, the essence is for us to know where we are coming from, for you to understand what actually happened. I know a lot of us would say that our parents didn't suffer some of these conditions that you're seeing today. Now, the truth is, a lot of our parents suffer this condition, okay? But the difference is that they didn't know what they were going through. They saw it as one of those conditions that existed in their time, and they had what they called it, okay? Now, earlier in the first BC, people were suffering from diabetes, okay? From the first BC, people were suffering from diabetes, but they didn't really have a name for it. Now, what happened was that each time somebody that has diabetes urinates, ants comes around, their urine and starts leaking the sugar in that urine. That is what was obtainable in their time, okay? And people lived with it, and that was how they used to diagnose somebody that had that disease, but they didn't know the name, they didn't know what it was called, they had no idea of anything about it, okay? Now, you can trace diabetes back to Demetrius Apamea in the 1st century. Physicians of the medieval Islamic world, including Avicenna, have written about diabetes earlier. In 1550 BC, some Ayurvedic physicians now call diabetes Madhumeha. And the idea behind it was that it was honey urine. That's a urine that tastes like honey. Okay, that was the idea behind the name Madhumeha. After then, some scientists called diabetes a disease of the kidney, and later it was called a disease of the blood by Thomas Willis. In 1889 was the very first time diabetes was related to the pancreas. This was discovered by Joseph von Mering and Oskar Minkowski. Paul Langerhans in 1869 discovered that there is a heap of cells, okay, that's what he called it. He called it a heap of cells in the pancreas, okay, which had a role to play in the metabolism of carbohydrates. I know you're wondering, that is where the name Islet of Langerhans came from. Now, later in 1893, Edward Langeis discovered that there are cells called islet cells in the pancreas that is responsible for the metabolism of carbohydrates. Now, that is when they now credited that name to the original person that discovered that there was a group of cells. He called it heaps of cells. But now what they did was that they called it Islet of Langerhans. Now they called it the name of the original person that saw that cell in 1869. Nobody knew how these cells were playing a major role. And so in the 20th century, a group of scientists in Canada discovered this vital substance that islet cells produced, which we call insulin. And that was when insulin was discovered. Although the discovery and purification of insulin eventually took place between 1920 and 1921. That was when insulin was purified, discovered and purified for clinical use, to treat diabetes. And this is the emergence of the treatment that we all, use today. Now, I want us to go to what diabetes is as a condition. Now, a lot of you think that diabetes is a condition that is caused by sugar. Even when it seems to be true for many people, but scientifically, sugar is not the problem of diabetes. Now, what happens in diabetes? Now, I'll use an illustration to help you further understand this. Now, imagine a flood situation, okay? We have a flood situation where water, goes, out of banks and out of roads and destroys people's homes and farmland and what have you. Now, a lot of people will blame the rain for falling, right? Now, for those of you that are blaming the rain for falling, it means that you don't understand the role that we should play as humans. We should create drainage systems, to help, to take care of the problem of flood, because the rains will naturally fall. The rains will naturally fall, and it is expected of us to create drainage systems to take care of, the rain when they fall. Now, back to diabetes. Now, this is what happens. Naturally, our body needs sugar for it to function. Okay? The cells in the body makes use of this sugar. Now, without the sugar, the cells in the body will die off and they will be dormant. They won't do anything. Now, what happens in diabetes is that there is a key. Okay? There is a key that helps to open up the cell for sugar to find entrance into the cell. Okay? In our biology, we are told that the cell is the smallest unit of an element. Now, a group of cells make up tissues. A group of tissues make up organs. A group of organs make up the system. Now, a group of system is what makes a whole human being. Okay? So, the collection of these cells in the body helps the body to function, helps the organs to function, help your tissues to function, help your systems to function. So when there is a problem with this key, which is called insulin, insulin is a key that gives sugar access into the cell. Now, the cell makes use of this insulin, as a key, to open up, okay, for sugar to enter into the body. Now, at every single time that there is need for sugar in the cell, it is expected that insulin is secreted by these islet cells of Langerhans in the pancreas. Now, when these cells don't see the action of insulin, that is the key. Now, I want to paint a picture to you so that you will understand how this thing works. Imagine you have an occasion, right? And you have invited guests. that are going to the house with you. Probably you did a wedding ceremony or a Thanksgiving ceremony, and after it, you were heading to your house with your guests. Now, on getting to the house, you discovered that you can't find your key. Now, what will happen is that it will keep you and your guests stranded outside the house. All of you will be loitering about around the house because you don't have access to the house. Now, this is exactly what happens with sugar. Sugar is like you and your invited guests, and there is no key to have access to the house, which is the cell. The destination of sugar is to get to the cell, but because there are no keys to open up the cell, what happens? Sugar cluster all over the bloodstream. And that is why the cells begins now to get starved. They are starved. And when they are starved, what happens is that they begin to show some kind of reactions. Okay? They begin to show some kind of reaction because they are starved and they are not having enough, to function. So, diabetes in the actual sense is defined as a metabolic disorder which is characterized by hyperglycemia. Okay? Hyperglycemia means a consistent rise in your sugar level. Okay? So, it is actually a systemic breakdown that happens gradually. When these cells don't find sugar to function, they gradually begin to pack up. The cells of your body, it affects every aspect of your body. I tell you, just that some organs or some systems are affected faster than the others. But the truth remains that diabetes affects every organ, every tissue, every system of the body. Okay? So, because the cell is the smallest unit of anything, okay? Any element, any organ. So, it means that every cell in the body during diabetes, they are starved. The cells in the body, they are not getting the sugar that they need for their function. So, there will always be a reaction. All right? So, the problem is not that you are taking in sugar. Just like the problem during flooding is not that the rain is falling. The rain will fall. The rain will naturally fall. You will naturally take sugar. You need sugar to live. Of course, there should be moderation. We understand. But even when you have a moderation and these functions, okay, these things are not taking place. This production of insulin is not taking place. You have a problem. And insulin is not available. You have a problem. Okay? The problem is not the sugar you are taking. That's what I want to let you know. The sugar you are taking is what your body needs to function, because everything, including your brain makes use of these sugars. Okay? Now, diabetes. We have three major types of diabetes. Okay? And then we have two other subtypes. All right? So, I will go through the types of diabetes quickly so that you're able to understand what these types are, so that you know what exactly is the type. Okay? Now, we have three major types. We have type 1 diabetes, Okay, and we have type 2 diabetes, and also we have gestational diabetes. Type 1 diabetes, type 2 diabetes, and then we have gestational diabetes. Now, what is type 1 diabetes? Type 1 diabetes is that form of diabetes that happens when the body is not able to produce insulin at all. Now, the islet Langerhans inside the pancreas is not able to produce insulin. Now, this is genetic. This is a genetic problem. It's an autoimmune, disorder that just happens. Now, what happens here is that the immune cells, of the body fight against the cells, that this islet Langerhans cell, these cells that you find in the pancreas, which produces insulin. The immune cells attack it. They see it as an antibody, and then they fight and kill it. Now, this leads to you having type 1 diabetes because the body is not producing insulin at all. All right? Now, in type 2 diabetes, it is a bit different. Now, in type 2 diabetes, what happens is that your body produces insulin, but for some reason or the other, your body is not able to make use of this insulin. It means that the body is resistant to this insulin. All right? So this insulin is available, but the body is not sensitive to it. The body is resistant to it. And this is a major problem. It leads to the body having little or no insulin for the cells to make use of, in the metabolism of sugar inside the cells. All right? So this is exactly what happens in type 2 diabetes. Now, for gestational diabetes, what happens? Now, gestational diabetes happens to only women who are pregnant. Okay? Women who are pregnant have this kind of diabetes. What happens is that the placenta during pregnancy produces a lot of hormones. Okay? A lot of hormones are produced, and these hormones, inhibit the function of insulin. Okay, they inhibit, they lead to the body being resistant to insulin, which the pancreas has already produced. It means that insulin is available, but because of the placenta producing other hormones, which counteracts the action of insulin, it leads to diabetes. So this diabetes is that the woman is now having issues in metabolizing the sugar or the food that she takes, and this leads to diabetes. Okay? Now, we will not go into the details of this right now, okay? But I wanted to explain, these types of diabetes for us so that we'll have an understanding of what actually happens in these types of diabetes. Okay? Now, for the subtypes, I mentioned earlier that type 1 is more of a genetic problem, and so you cannot prevent it. Okay? Now, it happens mostly to younger people. Type 1 diabetes, they call it early onset. Okay? Early onset of diabetes. So, it happens to younger people. However, it has been discovered that type 1 diabetes can happen to somebody who is an adult, probably somebody in their 40s, 50s, or thereabout. This is for doctors who understand this truth. It is called latent autoimmune diabetes in adults. That is what it is called. It is a subtype of diabetes. It is a type 1 diabetes. It is a late onset. It happens later in adulthood. Okay? Now, there is another type which, the type 2 diabetes is known to happen to older people, probably people in their early adults or elderly people, right? However, it can also happen to a younger person. Yes, it can happen to a younger person. And when this type of diabetes happens to a younger person, it is called majority onset diabetes of the young. This is where the type 2 diabetes comes early in the life of a young person. Okay? So these are the 3 major types of diabetes and then the 2 subtypes of diabetes. Okay? A lot of people don't know which one they are suffering. Okay? Now, this leads us to some of the symptoms of diabetes. How do you know you're diabetic? How do you know you're diabetic? What exactly shows that you're diabetic? Now, for me to answer this, I need to make an emphatic statement here. Now, there is nobody that has that duty to tell you that you're diabetic except the medical doctor. Not a lab scientist, not a pharmacist, not a nurse. Nobody has that duty to tell you that you're diabetic unless it is done through a medical diagnosis by a doctor. He's the only person that is certified to tell you that you're diabetic. A lot of you go into taking all sort of things because you feel you're diabetic. But the truth is, those symptoms you're having, it could happen to anybody. Okay? It could happen as a result of any other thing other than diabetes. And that is why when you have some of these symptoms, you're not meant to start taking care of yourself. You're not meant to start taking medication. You're not meant to start buying products, start taking those things yourself. You must find a doctor, see a doctor who will medically diagnose you. And when this doctor has diagnosed you and he comes and certifies that you are diabetic, that is when you are diabetic. But other than that, nobody has the duty. Nobody is responsible to tell you that you're diabetic. Not even me. I am not certified. I may know that you have these symptoms, yes, but there are medical diagnoses that needs to be done for you to know. Okay? I know you got value from this episode, right? You got value from the history, to the explanations, to the illustrations I used, which are commonly understood. The storyline behind it. I know you're able to get, to understand that diabetes is not the problem of sugar. Okay? I know you got value from it. Okay? I want you to subscribe to this channel because we'll be getting a lot more. We've not talked about the causes, the symptoms, the diagnosis, okay, and a lot more around it. Okay, we will do a lot of video to exhaustively discuss diabetes so that whenever you are wherever you are and you're asked anything around it, you have something vital to say. Okay, that is the idea. We want you to be enlightened enough to teach another person, to let another person, when you see somebody who is diabetic, you're able to ascertain if this person needs to go see a doctor to confirm if they are diabetic. Okay, that is the reason why we are doing this. Okay, so I hope you got value from this video. I'd like you to do one thing for me: like, and share. Like and share, and then subscribe to this channel, please. If you've not subscribed to this channel, subscribe to this channel, because we are going to be getting you a load of value just in the language that you will understand. We simplify these things. So this is just Diabetes Simplified. Okay, that's the title, and that is what we intend to do for other conditions. We want you to understand these things and be a master for explaining it to other people. Okay, thank you so much for listening. I remain your dietitian, Fechi, and I'll see you in the next episode. Bye for now.